First, what we're going to do is we're going to deal with the fear of abandonment. We're going to deal with that rejection sensitivity. And we're going to keep an eye out for that sense of emptiness. Now, emptiness does not equate to depression, two very different things. And this is also where it gets confusing. Living with depression and BPD is tough, but I've got some essential information to help you navigate through it. So stick with me, and here we go. So we're going to dive into the importance of connecting depression and BPD and why it's so confusing. And it really is, and it's understandable, because about 85% of individuals diagnosed with BPD also have a comorbid condition of major depressive disorder. Now, I talk about that in my book, Comorbid Borderline Personality Disorder, and you can check it out to learn more, and that's cool. But also, what I want you to be aware of are the components we're going to talk about here. And central to this is that recognize that if you have BPD and major depressive disorder, that means, right, that you have underlying issues, typically classic core content issues of borderline personality disorder tends to be abandonment or fear of abandonment, certainly, rejection sensitivity, and emptiness. Now, these are the three. That doesn't mean that if you have BPD that those are the only three you have or that you must have those three, but those are just the common ones, and we'll use those for an example. Now, what happens is that if you also have that comorbid condition of major depressive disorder, that if we just focus on the depression, we don't really see the depression remit at all. We don't see the individual getting any relief from the depression. What we see is, and there's about 25 years of research to support this, that if we work on those underlying issues, those BPD issues, then we start to see the attenuation in the depression. But one of those central components of major depressive disorder are also present in borderline personality disorder, and that's the paradox of mental health. The paradox of mental health is that in order to get better, you have to do these things. For depression, for example, you have to engage, you have to activate, which means in that activation is you have to challenge those depression-encouraging thoughts. You have to get up. You have to act in a healthy and positive way. The problem with the paradox of depression is that in order to do those things, you need the energy to do them, but depression takes away the energy to do them. So we're going to talk about BPD in just a second before we get into how do you manage it, right? Because if depression is sapping your energy to engage in the behaviors to lessen the depression, and this is even if you just have depression, then how do we deal with it? I'll tell you in a second. Because we also look at the paradox of BPD. BPD, what happens is a lot of people engage in maladaptive beliefs, behaviors, and patterns. And that is that, for example, you may want closeness in your relationship, right? You want this level of comfortable intimacy. But what happens is that BPD, that fear of abandonment and rejection sensitivity kicks in. So as you start to get closer, then you engage in testing behaviors. Well, I'm going to test him or her, see if they really love me, if they really care about me. The problem is that test is poorly written because there's no answers, right? Meaning that whatever you do or whatever that other person does, they're never going to pass that test because it's not multiple choice, it's not essay, there's just no answers because it's like, well, I'll just feel it. So many of my clients tell me, well, I'll just know when I feel better. Yeah, no, you won't. Because what happens is you don't know. You may have periods of remission, but without understanding those underlying issues, those underlying factors, you'll never know if you reach it or not. It's trying to get to Disney World without having directions. But by the way, you just want to get to Disney World. Now, you're not going to get in the car. You're not going to look up how to get there. You're just going to get to Disney World. Well, I mean, if you phrase it that way, aren't you like, well, how am I going to get there? Right. You can't have that same approach. But the paradox of BPD is that I want to be close, but as I start to get closer, then I'm going to test you to the point where then you reject me so that then I can beat you to the punch. I can beat you to the abandonment. So I'll feel abandoned. I'll feel rejected. So I'm not waiting for you to do it, which then means that it could happen at any moment. So that's the paradox. I want to be close, but I engage in behaviors that actually move us further apart. So in order to combat that, what we have to do is, and this is very similar to the paradox of depression, is that we have to start small. And that is, we got to catch that negative self-talk. I call that family in the head. And that's that chorus you have in your head, that series of voices, maybe mom, dad, brother, sister, cousin, teacher, therapist, whoever it is, in your head that tell you negatives. Now, we can turn it so it talks positive to you, and that's what we want to do, but it takes time, and it takes a lot of energy to do that. Because if you habitually have BPD, which if you have BPD or you have traits, you have that negative voice in your head a lot and all the time, and it's so loud. We got to turn it down, and you turn it down by challenging it. You turn it down by engaging in experiences that show you can succeed. It's that you engage in behaviors, whether they are getting activated in a positive way, and we know that if it's comorbid, your depression and your BPD, that you want to deal with BPD stuff first. So first, what we're going to do is we're going to deal with the fear of abandonment. We're going to deal with that rejection sensitivity, and we're going to keep an eye out for that sense of emptiness. Now, emptiness does not equate to depression, two very different things. And this is also where it gets confusing, because people say, well, emptiness is just depression. No, it is not. Emptiness for BPD is this hole inside that you can't fill. For depression, it can be helplessness, hopelessness, and worthlessness, but it's this, it has a bottom to it. Emptiness for BPD doesn't. And it feels like no matter how far you go, you're never going to reach it. It's like a good example is depression would be if you've ever seen the Shawshank Redemption, right? And they pull back this towards the end. And this is a spoiler, so if you haven't seen it, you may want to skip ahead a little, right? Shawshank Redemption spoiler, here it comes. But, right, he pulls back that poster and they throw like a rock down. You hear it go, cha-ching, 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 right? That's depression because there's a bottom, right? It eventually hits a bottom. Emptiness is that you would throw it in there and it would just go forever. Because that's what it feels like. It's very different. So what we have to do is we have to do that initial engagement, and it starts with challenging those beliefs about your worth, about your value, about what you can do, because depression grabs onto those same statements, and it continues to pull you down, and it drags you down. Now, when you take medication is not going to manage fear of abandonment, rejection sensitivity, or emptiness. It's not, because they're different, because they're core content issues. Your medication for depression, you may get some buoyancy, you may get a lift with hopelessness, helplessness, worthlessness, anhedonia, which is losing interest in things you once enjoyed, other aspects of depression, but those same central components aren't there. So then when you go back to your mental health provider, your psychiatrist, or even your primary care physician, you're like, well, I still feel kind of empty. Oh, well, let's keep increasing it. So what happens, and this happens to folks with BPD all the time, let's keep increasing it until you then reach a level where you're getting side effects, and then you have side effects, so you stop it, and then what happens? Then you go right back, right, to that major depressive disorder and BPD. And then they collide, and then you're continually dealing with that. That's why we got to get to what's underneath. We got to deal with those factors first. And this is really, really important. Having that awareness, helping understand where this comes from, exploring these things, but continually pushing back on those negative self-statements. That's where it has to start. And I want you to do that first. I'm not going to give you a whole bunch of strategies just yet. I want you to start with challenging those things. Push back on those things. Push back on those things with reality, and that you can beat BPD. Because by beating BPD, you'll attenuate, you'll lessen your major depressive disorder. Now, I'm going to put a link right here to beating BPD so that you can check it out. I want you to check out that video as well. Check out some of my other ones, because this is something that you can manage, you can deal with, and you can overcome it. I've done it with a lot of my clients, and you can absolutely do it. Tell me in the comments how you've done it and what works well for you, because people read those comments. And it means the world to me that people take their time out to write those things, positive things, encouraging things, or they explain their own experiences. Because I think I'm trying to build a community where people with BPD don't feel as stigmatized, that they feel heard and listened to. And I'm telling you, putting those comments in there, all of us working together to help people understand that you can do it differently, you can manage this condition, even if major depressive disorder is included as well. So check out that video, beat BPD, and I'll see you next time. Thanks.